Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some of the very common compensations that I'll see after a shoulder injury and how to avoid making these same mistakes when doing a rehab program. But before I begin, please hit the subscribe button so you can get notified about when any of my new videos come up, and feel free to share these videos with friends and family. So essentially with the shoulder, whether it's a post dislocation or a rotator cuff injury or AC joint injury, so some of the more common ones that you would see perhaps in hockey, what happens is we have to go through a very specific rehab program in order to strengthen some of the supportive structures that help to stabilize the shoulder joint, and these are referred to as rotator cuff muscles. Now, what I see a lot of times in the clinic is when somebody starts doing this exercise program, they might inadvertently be using other muscles to perform certain movements that we're trying to get stronger in the clinic. And so today I wanted to go through some of the more common compensations that you'll see and what you can do about them. So the first thing I want to talk about is what's referred to as internal and external rotation of the shoulder. So basically what that is, it's this movement right here, right, when we're bringing the shoulder in and out. Now what'll happen in a lot of cases is these muscles, so again they're rotator cuff muscles, one's called your subscapularis and one's called your infraspinatus, they will get weak after some sort of, again, traumatic type of injury, and we need to strengthen these ones. And so with external rotation, again, we're trying to strengthen the infraspinatus muscle, which is, again, this movement here. And what I'll see a lot of times, again, in the clinic is if that muscle, if somebody's not strengthening that muscle appropriately, or if it's remaining weak, one of the compensations or movements that I'll notice is instead of actually moving from the glenohumeral joint or the ball and socket joint here, the movement will actually take place at the shoulder blade level. And so instead of this specific movement, again, where the axis of movement is right through the shoulder joint, somebody will start actually moving from the shoulder blade. And so the movement will look somewhat like this. So there's actually no movement taking place here. It's all from the back portion. And again, this is a compensation we'll use as a result of that weakness to try to accommodate and do that movement without actually activating the correct muscle. Internal rotation, right, going the opposite way, in a lot of cases I'll see individuals overuse their pecs when they're doing this. So basically their movement takes place from the chest, right, as opposed to movement taking place from the shoulder blade. Now, what I found most beneficial in terms of ways to avoid this compensation is to use some kind of, whether it's a towel or a pillow, something to be placed in the armpit area, which essentially forces the individual to move from that joint, and it helps to prevent, as I said, either overusing the pecs or overusing the shoulder blade. So basically placing something there, setting your shoulder blade back, and so what I mean by that is essentially squeezing the shoulder blades together, and then making sure that the movement, again, is taking place in this sort of plane with the use of something in the armpit area. So that's for those two muscles. Now, in terms of the other two areas that we'll try to strengthen again after, while we're trying to rehab the shoulder, it's going to be biceps, which is shoulder flexion, and your supraspinatus muscle, which is another rotator cuff muscle, which does this movement out to the side, abduction. And so the biggest compensation that I see in both these cases is overusing, it's called the upper traps, which is one of the muscles that connects from the shoulder onto the neck region, essentially. And where somebody will, especially if they're weak, let's say out in front here, they'll try to compensate by overusing, right, the upper trap muscle, and also overusing the upper trap going into abduction. So what I found was that two things that I'll have clients do or patients do is lots of work in terms of stretching out that muscle, right? So maybe a side stretch of the neck to really try to relax the upper trap, and then actually setting, as I mentioned, setting that scapula or that shoulder blade down as the shoulder comes up. So basically I'm squeezing those shoulder blades back, and then as I'm raising, I'm really making sure that that shoulder blade is staying down and not elevating, right, as that shoulder comes up. So again, just to summarize, a couple different compensations that we'll notice in the clinic with rehabbing the shoulder specifically: overusing upper traps, overusing pecs, overusing muscles that support the shoulder blade. If you have any questions or concerns, please feel free to comment below, and have a great day. Take care.